You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is the go-to implant dentist in Nashville, Tennessee. With us, we have Dr. Andrew Kim. Dr. Kim, welcome to the program.
It's a pleasure to be here. Thanks for having me.
Now, I know you brought a stack of photos. So we'll try to get to as many of those as possible. For people that don't know your practice, like who's the typical dental implant patient?
Well, typically these kind of patients fall, in two categories. The first category is people with natural teeth that are failing. They have tooth problems, they have rotated teeth, discolored teeth, they have pain, infection, and they're really scared they're going to head into a denture. For those people, what we could do is provide them with a new set of upper and lower teeth supported by dental implants that never come out.
Okay. What about the second group?
The second group of people are people who are already in dentures, they're already missing their teeth. When they come to see me, I could provide them with a set of new teeth on top and bottom that are supported by dental implants that don't come out.
You say as little as 4 dental implants to give them a full arch of teeth.
Exactly.
Is that right?
Yeah, the misconception is you need an implant for every single tooth. In actuality, you only need 4 to 6 to anchor, full arch of teeth.
So when I say at the top of the show, no more dentures, is that the future of dentistry in your opinion?
I think it's the future of dentistry.
Like all teeth, whether it's a denture, will be attached to something?
Exactly.
What do you think?
I think that's the future of dentistry. I think we have the technology now, but just with all technology, as we progress, it's going to get faster, easier, cheaper. So it is the future of dentistry.
Now, we were talking in the group, you travel all over the U.S. and even out of the country to learn this technique.
Yes, sir, that's right.
You were just in Brazil.
I was just in Brazil learning advanced techniques for implant placements in patients who have little or no bone.
Okay.
There's solutions for everybody. We're not limited currently by how much bone you have. There's ways to work around all these issues.
So correct me if I'm wrong. The way dental implants are typically done is you go to one doctor that does the surgery, puts the implants in, and then another doctor that puts the teeth on top, and then another doctor to maintain them. At your office, you do all 3 parts right there. Is that right?
That's right. We do everything in-house.
Okay.
Traditionally, patients, they would go to a surgeon to get the implant placed. You go to the restorative dentist to get the tooth put on top. You'd have to travel between, 2, 3 offices. But at our office, and, patients love this, they just come to one spot. They have one dentist, me, working on them, and we provide everything from start to finish.
Now, you said that you could do this in like 2 or 3 appointments. Like somebody watching this, if you had an opening on your schedule, the day after tomorrow, they might be able to get new teeth.
Exactly. We could do this as little as 2 or 3 appointments. That's correct.
Now, you have your own lab. Why does that matter?
That matters because we make the teeth right here in office, and we have full control.
You say you have a printer that prints the teeth.
Yeah, so the benefit of having an in-house lab is I get to control everything from start to finish.
Okay.
I paint the teeth myself, It's not a one-size-fits-all. Everybody has different shaped mouths. They have different colors of their gums. They have different colors of their teeth. So I'm able to kind of fine-tune all the details while the patient's sitting there in office.
So like somebody 80 is going to have a different
exactly
look than somebody in their 40s.
Yeah, typically, when you're 80, you want age-appropriate teeth. If you want something more natural, you don't want a Hollywood white smile. You want something that looks good and looks natural when people look and talk to you.
Okay, so you of course have lab techs that do it, but you do it yourself. Are you a bit of a perfectionist?
I would say, unfortunately,
have you ever been told that?
Yeah, unfortunately, I am a bit of a perfectionist. I like to control the process from start to finish so my patients get the best results.
How old can you be to get this done, to get new teeth supported by implants?
Age doesn't really matter. As long as you're able to walk in the office and you're relatively healthy, it's never too late to get implants done. You don't want to hold yourself back. You want to improve your quality of life. You want to be able to speak and talk and, be social. It's never too late.
What's your oldest patient?
My oldest patient is 90 years old. We get, missing a couple of teeth. She wanted to improve her quality of life, so we got it done.
So
my
you
colleagues,
put implants in somebody 90 plus
Exactly,
years old.
exactly.
Were you a little scared?
No, she was healthy. She was actually did
But
better
were you scared?
Not at all. She did better than my younger patients.
So statistically, if you're in your 90s, because we were talking off camera that people 100 years old are doing this.
Sure, exactly. It's never too late. The bone heals just fine. As long as you're healthy overall, implants are not a problem.
Yeah, but isn't it true if you've been wearing a denture like 20 years, you can't do this, you don't have enough bone?
That's a kind of a misconception. Just depends on the level of training your implant provider has.
Okay.
If you go to a different office, some people might say you don't have enough bone, but I rarely found that to be the case. Most people, we have, more advanced technology. We have better implants. We have more better diagnostic imaging. So, we could place implants on people with little to no bone nowadays.
So you plan this on a computer? Like you do a surgery ahead of time?
Yeah, so we do the surgery ahead of time. We take a 3D X-ray. With that 3D X-ray, I'm able to kind of plan where I'm going to put the implants in, and I kind of run through the whole process in my head and on the computer before you even sit in the chair.
Is that right? Could you sometimes show the patient what they think their teeth are going to look like ahead of time?
Exactly. We have digital software. We could kind of design it, overlay it on top of your photos, and we could kind of blueprint the whole process and kind of show you what it's going to look like ahead of time.
Now, at your practice, you were telling me that you save teeth sometimes too. You just don't do one thing. I guess you do your own root canals,
sure,
orthodontics, cosmetic, veneers, things like that. And you told me that what would typically take maybe 2 or 3 specialists, you're able to do right there. Can you elaborate on that? What that means?
So, as a general dentist, I like to save teeth as long as possible.
Okay.
Although I do a lot of implant-related treatments, I do believe the natural teeth are the best teeth. It's only when those natural teeth fail, there's no more hope, is when I try to do replace them by teeth on dental implants. At my office, we do a lot of orthodontics. We straighten teeth out. We do laser gum therapy to try to save the natural teeth as long as possible. I have some cases you'll see up ahead that if you went to a different office, they would recommend taking all the teeth out. In my office, we try to save one arch of teeth if possible, and when another arch is not able to be saved anymore, we take those teeth out, we put implants in, and we put a set of permanent teeth on top of those implants.
Now, can your gums be too bad to do this? Like people with gum disease, this bacterial infection?
Not at all. That's our typical patient, is people with gum disease or gum infection. We have a special laser. It kills everything. It targets that bad bacteria that causes that gum infection. And like I said, when possible, we try to save those natural teeth. But once you get those bad teeth out of there, the gum infection goes away. The teeth are the source of the gum infection. Once we take them out, we clean everything up, get all bacteria out of there, and everything's good to go.
So right there. Now you brought some photos. What are we looking at over here?
We're looking at some of these cases, some of these dramatic cases. Here's the first patient.
All right.
Yeah, so this young lady, this is a very exciting case. She came to us because she couldn't smile. If you look at those before pictures, she has a gap between her front teeth. It's always been there. She just never liked it. She has gum infection. Her teeth are starting to flare. She can't even close her lips properly just because the teeth are so flared out there. It just doesn't look good. She's self-conscious about her appearance. Her teeth are hurting. She can't bite an apple because her teeth are so loose.
Is that right? Okay. Is that common? Like their teeth are so bad they can't eat?
Exactly. Like normal foods that you and I could eat, we kind of take it for granted. Harder foods we could bite, no problems. But when people have gum infection, when they bite down, their teeth move. It hurts, and they're worried about these teeth falling out. With her, we were able to save the bottom teeth by doing laser gum therapy, and then we didn't have to take any bottom teeth out. With the top, we determined it was too late. These teeth were just too far gone to save, even with laser gum therapy. So we took the teeth out. We give her a full arch of upper teeth supported by implants. And then this is how, same day she walked out with a nice smile.
She looks good.
Yeah, she looks great. If you look at the before and after photos, the first photo looks like she could barely smile. She can't even close her teeth. She has creases. She has creases in her face. She can't even really smile. The second photo, she's still kind of struggling to smile just because, she hasn't smiled in such a long time.
Is that right?
But it looks more natural. And
when you say they have to learn to smile all over again.
Exactly.
What do you mean by that? So
when people are embarrassed with their teeth, they try to hide their teeth. When they go in public, they train themselves to reverse smile. They hide their smile. So gaining that smile back does take a little bit of time, but it's a huge transformation when I see them from the day of the procedure and fast forward to even a couple weeks. But yeah, that's it's just completely transformative.
Now, when we were speaking in the green room privately, you showed me this one photo. We talked about her in particular, and you said that and I'm paraphrasing you slightly, but most centers would have also removed her lower teeth as well.
That's correct.
And given her, this full arch of teeth supported by implants, and that's a lot more expensive.
That's true. Unfortunately,
is it a philosophical difference you have about saving teeth, or what is it?
It is. It's my own kind of personal philosophy. I do like to save natural teeth when possible. You only get one set of teeth or one set of adult teeth. And then once that set is gone, we do have the technology to give you a third set, but, if we could delay it a little bit. Typically patients, when when I show them a mirror after the procedure's done, you see a huge grin on their face, you know.
Is it emotional for some of them?
It's very emotional. Some people start tearing up, you know, some people kind of, you know, they thank me for changing their life, but, you know, ultimately it's them who, you know, decide to come in and help me change their life.
That's nice. So but do they ever say that, like, Doc, you changed my life?
I hear that pretty often.
And it's them, you say?
It's them, yeah. It's just the patient. Yeah, the patient is the one who made the steps to seek our help. And, you know, we just have the tools to help them out.
Are there a lot of people, when I think of Nashville, I think of a healthy group of people. Are there a lot of people either headed to a denture or wearing a denture? Is it a big problem?
Unfortunately, it is a big problem. In the United States alone, there's about, you know, depending on the statistics you read or hear about, there's about 36 million people with no teeth.
Right?
If you do the math and divide that by 50 states, there's about enough patients to fill the Tennessee Titans Stadium more than 10 times the amount of people who don't have teeth in Tennessee. So it's a huge problem.
Is that right? Well, why aren't they all doing it? I mean, if it's so good to get new teeth supported by dental implants, what's your take?
My take is there's about 4 to 5 reasons why people don't take that first step. I think one of the first categories of people who don't take their first step is they've been through a lifetime of dentistry. They started when they were a teenager. They got fillings done. Those fillings turned into crowns. Maybe they lost a tooth, need a bridge. They had root canals, gum infection, teeth infection. They're just, you know, in pain all the time. They fix one side of their mouth. Fast forward a year, the other side of their mouth starts falling apart. So because of that, they're kind of...
They don't want to go to the dentist.
They don't want to go to the dentist anymore. They're kind of scarred.
It's a lot of money, too.
Exactly. So it's sometimes, you know, it almost seems never ending to them. You know, every year they max out their insurance. They have to pay something out of pocket. So they're kind of tired of going to the dentist. So these kind of people, you know, they're almost relieved when they take all their teeth out just because they know all that dentistry is.
And the pain.
Yeah, all the pain will be gone. Exactly.
Now, most of these people, when they do this, they're numb. And you use some sort of sedation, like IV sedation?
Exactly. So we have all kind of sedation options at my office. We could do oral sedation. You take a pill, you know, about 60 to 90 minutes before. Next step up is doing IV sedation, which is safer because we could titrate the levels. We could, you know, take you in and out of sedation. And, you know, we also have nitrous oxide, but typically when we do these kind of implant treatments, IV sedation is the best option. The best thing about IV sedation is the amnesia effect. So the drugs we use today make you forget about the procedure. I had a couple of patients recently. They came in. When they came in for their 1 week post-op, they said, "Doc, I didn't remember a thing."
Is that right?
Exactly.
So they just get a ride home. And what's that aftercare like? Like, how soon can they eat? Does some of them take over-the-counter, like, you know, ibuprofen or whatever to take care of the pain? What's that like?
Yeah. So after you get these, you know, full arch implant replacements on. You know, you want to take it easy for the first couple of months, but you're able to eat same day or next day. Also, a lot of my patients, you know, I prescribe them pain medication. They don't even want to take it. They just take over-the-counter Tylenol, ibuprofen, and they're comfortable with that.
What do they like more, the way it looks or what they could eat?
So a lot of men come to see me, and they said, "Doc, I don't care about looks. I just care about function. I want to be able to eat that nice steak, you know, that I want to eat without my teeth falling out." What I kind of find out is you fast forward a few months and then they're smiling more, their personality has changed, and they love the looks of it. They're taking photos, they're looking good.
They like the look better than being able to eat and chew.
Exactly.
And you can eat whatever you want. I mean, you don't have to be careful with like biting a carrot with your front teeth? Or is that okay?
That's fine. That's perfectly fine. That's the benefit of having these full arch teeth on implants. You could bite carrots. You could eat these healthy fibrous foods. You could crunch on celery. You could bite an apple. You can't bite an apple with dentures. It's going to dislodge your dentures.
Now, most of these people, like you said, back to this woman with the gap in the front teeth, that most of these patients, you said, they haven't liked their smile for 10 years, 20 years, even longer.
Sure. Yeah, that's exactly correct. They just live with this day in, day out, not liking their smile. So even when they smile and talk to people, they're self-conscious. They can't be their true self. They can't laugh. They can't let loose. It's pretty unfortunate.
You say they're judged for their bad teeth.
Exactly. So unfortunately in our society, when you have bad teeth, it almost appears like you're not taking care of yourself, right? It almost appears like, unfortunately, like, you don't, you might not have the money to fix your teeth. You might not have the education to fix your teeth. It's, if you look at Hollywood today, you don't see any actors with bad teeth or missing teeth.
Yeah, that's a good point.
Exactly. And conversely, when you see all the bad actors or the villains in Hollywood, they all have missing teeth. They have discolored teeth.
Is that right?
Exactly.
So yeah, I guess like a director, if you want to make somebody look homeless, you want to make them look down and out, give them bad teeth.
Exactly.
So there are dentists in like LA or Hollywood that are making these bad teeth for the actors.
Sure.
To make, if depending on their role.
That's true. I mean, they make like fake teeth that are made to look bad, but these are just temporary teeth. They're not, we don't make these teeth for people to walk around in. Here's another lady that came to us. She was not happy with her smile. She had chipped teeth. She's missing multiple back teeth. Her before pictures don't look too bad because, she has most of her teeth when she smiles. But all her back teeth, she had gum infection, she had tooth infection, she had abscesses.
So she was headed for a denture.
She was headed for a denture, potentially.
Okay. So they don't want dentures.
Yeah, nobody wants a denture.
Do they say that to you? Do they say, Doc, I don't want a denture?
Exactly. A lot of people, dentures have a negative connotation associated with them. They might have seen their grandfather, at the family dinner, the teeth fall out when they're eating, so they just don't want dentures. They don't want to mess around with that. But yeah, she came to me, failing up her teeth, and she wanted a fix. So we were able to kind of treatment plan a full arch of teeth on 6 implants. She came in, we took photos, we took records. I only have to meet people maybe once or twice before I do the procedure.
Okay.
Usually I do recommend people to meet me. The first appointment is kind of a meet and greet, and I tell them any questions you have, let's meet again. I want you to feel comfortable moving forward.
Okay.
So we took records, we got her appointed, gave her some sedation. She was comfortable. She pretty much slept through the entire procedure. At the end, she woke up with a beautiful smile.
Looks good.
Yes, sir. It looks great. I think if you look at her face, it's just a different woman. In that first photo, she doesn't even want to open her eyes. She's kind of embarrassed with that smile. In that second photo, she's almost posing for it. She has better clothing on, better jewelry on. She just looks like a whole new woman. And even her personality, she has a great personality. And now her teeth match her personality.
So it kind of comes alive.
Exactly.
And you said like they come in for their cleanings or their follow-ups, and they're different.
Exactly.
Like they're acting different. It's noticeable.
Exactly. So
is that a self-esteem thing, you think?
It is a self-esteem thing. And then when they come in, I think they're kind of, embarrassed of their teeth. They're afraid somebody's going to judge them. I don't judge anybody. When they come in for their recall appointments, they have a nice set of new teeth. They're very proud. They carry themselves better, and they're just more comfortable. Let me show you this next patient.
All right. Wow.
So this is another patient, a male patient. He came to me because, he had multiple loose teeth, bad breath, gum infection. The bottom arch is kind of falling apart. And this is another one of those patients that if you went to a different implant center, they might suggest taking out all his teeth and giving him full arch new teeth supported by implants on top and bottom.
Okay.
At my office, we determined his upper teeth were generally in decent condition. He has gum, infection, but I was able to use my laser and disinfect the entire top.
Okay. So you saved the upper teeth.
Exactly. We saved the entire upper teeth.
So the lower teeth you couldn't save.
The lower teeth were too far gone.
That's got to be unusual, though. I mean, what's going on in the bottom? Is it?
It seems like it, but we see this all the time. So most of our patients are patients who have gum infection, and their teeth are just non-restorable or failing. So on this patient on the bottom, we decided the best course of action was to take out the remaining lower teeth. We placed actually 8 implants on this patient because he's a male, stronger bite forces. I want to over-engineer these cases, make sure it lasts as long as possible.
Okay.
And then we printed out some new teeth in the room next door. He left, nice brand new smile. Before he came in, he couldn't bite an apple. Those teeth they're flapping in the wind, they'd fall out. But after we got those new teeth in there, he could go home, eat whatever he wants, and all that bad breath is gone, all that anxiety of those teeth coming out is gone. He's just a brand new man. Now, look at that after.
All right.
The bottom teeth are nice and white, straight, they look good. The top teeth, those are his natural teeth. They're a little bit stained, but we cleared up all that gum infection. The roots, the foundation is good. The benefit of me being a general dentist is I could fix those top teeth right up, get them looking good.
So whitening, things like that.
Exactly. We could whiten. If the whitening doesn't work as well, I could veneer them, so I could do everything. We'll place the implants here. We'll get your natural teeth looking good. We'll complete the whole package.
He could eat whatever he wants.
He could eat whatever he wants. That's right. He could eat all those healthy, fibrous foods that he's been missing. He could take a bite out of a steak with no problem.
Is it more women than men, more men than women?
I would say
that are doing this. They're getting new teeth.
I would say about equal. Of course, men and women, we have different things we want. Men typically want function. Some women want looks, but ultimately they want looks and function. That's what makes my patients most happy.
And do all this
exactly.
And now they could last as long as, just like regular teeth, as long as you brush them and take care of them, they could last forever.
Exactly. With implants, you still have to, clean them. Even though they're not teeth, you still have to brush them. But if you take care of them well, they should last
And they don't
a long
stain,
time.
these new teeth that you give them.
Exactly.
What are they made out of? Like the
So
teeth?
in my office, we only use zirconia. I don't use, resin, for the final set of teeth. Zirconia doesn't stain. It looks good from, day one up to day, up to 5, 10 years. It doesn't stain, highly polished. It doesn't attract that plaque. It's just a wonderful material. This is another case we did.
Okay.
This gentleman came to me. He had these old crowns that were chipping away. The way that they were restored, he had short teeth. When he smiles, he doesn't show much tooth structure. He wasn't looking good, feeling good. He also had some gum infection. So with him, I was able to do a deep cleaning. He didn't need the laser therapy exactly, but I was able to clean his gums up, get a nice foundation. I was able to save the majority of his teeth, but he still needed a couple implants because some of his natural teeth were not restorable.
Okay.
So this case, we did his upper arch. I did some of the bottom arch, but we didn't do the whole bottom arch. If this patient walked into any other office, they might have suggested to, take out all his top and bottom teeth and do this procedure called all-in-4, which costs 5, 6 times as much.
That's where you get a full arch of teeth on 4 implants.
Exactly. So at my office, we were able to, save his natural teeth, put some implants when necessary, and restore a smile to proper function and form.
Are those upper, are some of those veneers?
Yeah, so some of these are
crowns,
crowns, veneers, and implants.
Okay. And he's looking good.
Yeah, he looks like a whole new man. You see that smile is a very radiant smile. His smile now matches his personality. He's a happy man. Here's another case where we did an upper set of new teeth on implants.
Wow.
So I actually met this patient years ago, maybe 5 years ago. He's actually the uncle of one of my old classmates from grad school.
Okay.
He came to me initially. He wasn't ready to take out all his teeth. He had, only a couple of teeth remaining, and he just wanted partial dentures. So we made him some partial dentures that you take in and out. Of course, by the nature of partial dentures, they're not that comfortable to wear, so he just never wears dentures. Ultimately, what happened is his front teeth started breaking down, and he finally made the step in saying, let's just take out all the remaining upper teeth. Let me get a full arch of teeth on 4 to 6 implants. So this is exactly what we did this on this gentleman.
That's probably what you wanted to do in the first place.
Exactly.
Right?
I mean, if he did this about 5, 6 years ago, I think it would have greatly improved his quality of life.
This is nice. So this is one of your buddy's uncles.
Exactly.
Okay. And so what does this guy say? I mean, because that's a big difference. Because now he can smile.
Exactly. So actually, the day of the procedure, when he walked out with that brand new set of teeth, he said, man, this is the first time since I was 17 years old that I had a full set of teeth on top.
It's good.
Exactly. So he's just a happy man. He's always smiling anyway, and now his smile matches his persona.
So you could start with like one arch, like an upper arch, and what are you going to do for the bottom? Like, what's your goal there?
Exactly. So this gentleman wanted to start with the upper arch because when you smile, you see mostly upper teeth. But the bottom arch is about in the same situation. So to make things a little bit easier for my patients, we could just do one arch at a time. We could do both arches at a time. It's just whatever you're comfortable with.
Now, insurance, we know, like Medicare, Medicaid, even the best dental insurance covers very little. But you say you have payment plans.
We do have payment plans.
So people with okay credit,
sure,
they're financing it.
Exactly. So we have, payment plans where if you have good credit, you could finance this over a period of years, and that way.
Do people do that, or is
yeah,
it common?
It's very common. Yes, sir. It's very common.
So we have about 2 minutes left.
Can I just show you a couple more photos?
Sure.
Yeah.
I'll rush
a couple cases. Let's go for it.
Okay. Oh wow.
So this patient walked in, failing teeth on top and bottom, and when she smiles, it just doesn't look good. So she's went to multiple dentists over the years, and she had a couple implants placed in, she had a couple implant bridges placed in, but the rest of the natural teeth were failing, where it was too hard to kind of save the old implants and put new implants in and kind of utilize everything. So we want to start off with a fresh foundation.
Okay.
So what we ended up doing is taking out all our natural teeth, all the old implants that were failing, and I placed 6 implants per arch and put a new set of teeth on top and bottom.
Looks nice.
Exactly. And then, the day she walks out of the procedure, she has a new set of teeth. She's able to eat, whatever she, has been missing. And then this has taken off 20 years of her appearance. She's just a whole new woman.
Now, we're short on time here, but snap in, snap out dentures. You're not a big fan because you said the patients don't like them very much. And you used to do a little bit of those, and I guess here and there you do them. Could you give me your stance on that?
Yeah, so snap in dentures, ultimately what they are, they're dentures. They have more stability, more support than just non-implant supported dentures. But ultimately what you're getting is you're getting acrylic in your mouth. that's a little bit porous. Over time it stains, it kind of smells. So I ultimately really recommend doing full arch zirconia teeth on implants for my patients, just because zirconia looks better long term. You don't have to worry about taking in and out. You don't have to worry about maintenance. You don't have to go back to the dentist every 6 months to a year to get those inserts changed out with those overdentures or those snap-in dentures. So ultimately, we can do snap-in dentures. Not the best treatment.
You really want the upper and lower teeth that don't come out.
Exactly. That's the closest to natural teeth you're going to get.
And they can eat whatever they want, as mentioned.
Exactly. I want the best for my patients, and that's upper and lower teeth that don't come out.
Now we're out of time, but final message. So let's say a patient's watching this. There are the two categories that you described. Really, really bad teeth and gums. They feel like they're going to end up in a denture, or it's the denture wear. They've heard what you have to say, but they're skeptical. Maybe they're afraid, right? You say people are afraid to do this. What do you say to them?
I tell people let's come and meet, low pressure environment. Let me just give you the options. Just come in, take an X-ray, sit with you in the chair. Give you different options you could go, and then we'll make a decision together. Then after that, if you decide to go forward, there's all different kinds of sedation options. We're going to get you as comfortable as possible. Typically these kind of cases, after you're done, you don't remember a thing.
Is that right? So in as little as 3 appointments, like they meet you on the first one, the second one you take measurements, and then the third appointment they get their new teeth.
Exactly. So
sounds easy.
Yeah, easy enough.
It's technically demanding on your end.
Exactly.
But what do they like about it most? I've asked you that before, but what seems to be the number one thing you hear when it's all done?
What they like about it the most is just that new smile. They get their personality back, they get their confidence back, they get their chewing ability back. There's multiple factors, but ultimately I believe it's that smile. The smile is just priceless.
If you want to make an appointment to see you, do you prefer they go to the website or just call your office and make an appointment?
Yeah, call our office, make an appointment. Send us an email.
Do they get to see you?
They get to see me
on that consult. Okay.
Exactly. So during from the first consultation up to the day you walk out with your new teeth, I'm the one who's going to be there. I like to greet all my patients. I like to make you feel comfortable. I would definitely want to make sure that we're both on the same page before moving forward.
Okay, and even if you have limited bone.
Even though you have limited bone, we have different techniques. We have new technology, new implants that we could utilize to, make sure we could get a full arch set of teeth on those implants.
All right, great. So no more dentures.
No more dentures, exactly.
Do you think you can end it in Tennessee?
I'm going to try. I'll try.
All right, I want to thank you for coming to the show. Good stuff.
Thank you so much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.